CES is an all-island, not-for-profit organization that has expertise in research, evaluation, program and change management, as well as implementation. Implementation is about a deliberate and thoughtful process of turning evidence and research into policies or practice. So it is about avoiding kind of haphazard or best practice or best attempts, but using established methodologies to try and put a structure around how things are turned into real life. And by doing that increases the chances of success of the policy or the strategy delivering the outcomes that people expect.
So we'd use implementation science to develop a service to provide us with a logical way of implementing a program, a service, or anything really that you need to implement, whether it's an organizational level or a system level or a national level. That's one reason. I think it's a good start point. Another reason would be that actually it would help us to achieve more effective outcomes from the very start. Okay, so what happens a lot of the time is people roll out a program and then they go a year later and evaluate the program and try and improve the service and see where the gaps are. Whereas with implementation, what you'd find is you'd have a better start position, basically is what I'm saying. So the difference with using implementation science and practice approaches as opposed to just going ahead with it is you get a really structured approach. As we mentioned before, it helps you to plan this out ahead. You can plan ahead for contingencies and stuff. But I think it helps you to really understand the context in which you are implementing it. So that means, for me, that the people who receive the service at the end of the day are going to get a better service, quicker and more effectively, which means improved services for people, which is what we're about really. I suppose the first thing for us here at CES is the way we go about this is that it's more of a partnership. It's not just us coming in to tell you how to run your implementation or to tell you what to do. So in that sense, it's not traditional consultancy. We like to co-produce, we like to collaborate, and we like to work with people. What we understand though is there's a lot of science, implementation science, there's a lot of knowledge around about it. So what we also like to do is to come in and we translate that academic knowledge or theoretical knowledge into practice, really so that practitioners understand and can use it when we've left. So really, I suppose there's another piece about us building capacity and capability with the partners that we're working with in terms of the implementation piece. And it's really important that we work with you. You know the context of the setting that you're working in, and an implementation context is everything. We could take an evidence-based program off the shelf and bring it in and say you should implement this, but actually it may not work in the context that you're working within. It might not suit local tradition, it might not suit the culture of where you're working, things like that. So again, that's a piece of work that we do. We come in and we do some workshops, we would interview, we do surveys. There's a lot of exploration and preparation before we actually get into the implementation. And that's with a range of people. This consultation process takes a little bit of time, but it's really worth it in the end. That exploration, then that's a big piece for us. That's where we find out what the context is. But then we kind of move into the planning of the actual implementation itself. And we do this in a phased approach. So we move on to the planning next, and we plan how we think the implementation is going to roll out, again, in consultation and working together and all those kind of things. Because again, people we're working with know the setting better than we do. They know what's going to work and what isn't going to work. So once we've got that piece done, the planning, what we'll do then is start off with an initial implementation. Now we could do that in a number of ways. What you can do is you can just roll out an initial implementation across a range of services, across the whole range of your organization or your system, and to see how that goes. Or you can start off with some kind of what we call pilot sites or micro implementation sites, where you might start, say, with 2, see how that's going, have your feedback loops in place and get all the information coming back. And again, that kind of speaks to that flexibility we talked about the first time around a minute ago, is that we can tweak things. If things are going off course or they're not quite working the way we thought that they would, we can tweak those and make them work the way that we need them to once we're happy, and we're happy that things are working and we're getting the kind of outcomes and that we're at, we get onto this last phase, which is really the full implementation and the sustaining and scaling of this whole intervention or program that we've implemented with together. So that's the 4 phases, and within that there's different activities we do and stuff, and we can get into those kind of details when we start doing the work. So where does implementation work best? I think it works anywhere, really. That's my belief. And here, I think again, it's about that context and exploration phase we talked about earlier, that you have to be aware of where you're working and what the context is. But certainly here at CES, we've done some work in some really kind of complex areas like prisons. We did some work with the Irish Prison Service. We've done some work with looking at implementing or supporting the implementation of children's standards. That was a national piece of work. But then again, we've also done some work with Respond, an approved housing body, where we looked at their tenant engagement process and things like that. So you can see there's a scale of stuff in a lot of different areas of social policy or policy areas. And I think really what we're doing is we obviously need some background knowledge of the way that the services work in those environments, but that comes from that co-production and collaboration piece. That's where we get that knowledge from. We ask the questions and we apply the practice, the implementation practice and the implementation science approaches to help us to understand what's going on and try and kind of marry the two up. And hopefully at the end of the day, as a result of that, you have a successful implementation.
Do get in touch with us to see how we could help you.